Hello and welcome to Health Professional Radio. Thank you so much for listening with us today. In view of the sweeping changes in healthcare, known as the Affordable Care Act, many people are looking for options, seeing as how healthcare is the law now. Is compliance with the law a justification for basically getting less service for, well, in some cases, more money, and in some cases, actually getting what you paid for, even though it's not a whole lot? Our guest in studio today is Dr. Frank Ditz. He's a board-certified physician located in Rockledge, Florida, specializing in primary care and family medicine. He's also an Air Force veteran, here today to talk with us about Signature MD Concierge Medicine and the benefits for his patients under this service. How are you doing today, Dr. Ditz?
Very good.
Signature MD Concierge Medicine. Tell our listeners exactly what Signature MD Concierge Medicine is.
Okay. Signature MD is one of the oldest players in the field of concierge medicine here in the United States. It's a national group of doctors with like minds that don't want to treat their patients like veterinary medicine, that want to spend the time and to really take care of the patients, not only for the acute situation, but also to prevent them from having diseases that we'd have to treat later. In the Signature MD model, they have a network of doctors all over the United States, of which we do cover with each other and have the ability to cross-cover our patients should they be traveling. But the Signature actually provides a framework through which we can actually take care of these patients. Signature comes out, they actually help the doctor to start their transition from usually a busy private practice into the concierge medical program. After they bring they actually will send a staff member to the physician's office, and they'll actually talk with the prospective patients about the benefits and the things that are responsible for the concierge medical practice, and actually help the patients to decide if they would like to join or not. In the Signature program, we have it's called a hybrid program, where not every one of my patients have to be in the Signature program. They can actually stay in the traditional practice of medicine if they're happy with that, and stay with the same office and the same staff. So we're not economically credentialing anybody. Every patient that wants to stay here has always been able to stay here. But for the patients who want to go a little bit further and don't mind paying a little bit extra for it, and it's not that much, they join the Signature program, and I think the rewards are great. In the Signature program, patients pay a certain amount of money, and it's based on the doctor's location and, of course, the doctor's overhead and things like that, and how far they restrict their patient load. But the patients will come in, and for typically my routine patient is 45 minutes long. So the typical doctor in the United States spends 2 to 3 minutes with the patients, and usually a maximum of 7 minutes. But my traditional patient every day is 45 minutes long. We have once a year or twice a year if needed. The patients have a 90-minute face-to-face comprehensive office visit with me. That doesn't include the technician time to get their weight and their blood pressures and to do any procedures we do, but an actual 90 minutes face-to-face where we sit down just with me and the patient and/or the spouse, and to go through all their concerns, all their worries, go through all their medical problems, all their surgeries, their risk factors, and also to do their exam. At the end of that, Signature program provides what's called a SMD lab and MD Talks labs, where they give us an amazing opening for a profile of labs that I think are world class. We usually draw 9 vials of blood on our patients, and based on those 9 vials of blood, we can do specialized testing that typical insurance companies don't cover, which will actually help us to determine risk of not only diseases that they don't know about, but also the diseases they do know about, and the risk factors for other diseases.
Are we talking having to be wealthy in order to afford it on a monthly basis? And my second question is, have you noticed any soldiers, veterans transitioning from, well, maybe VA care into concierge medicine, particularly under Signature MD?
Yes. As a matter of fact, the cost for being in the Signature program is not much more than the cost of a latte at Starbucks once a day. So it's not expensive at all. It's in the $100 a month range. So it's not anything that's going to be catastrophic to most people in the United States. So it's not an expensive proposition whatsoever. Insurance companies don't usually provide any compensation for the patients who join the Signature program or for any of the concierge practice. They pay their typical office visit. They'll pay for whatever they routinely would pay based on the ICD-10 coding that we have for the patient, that is based on the electronic medical record. And so this is actually an addition to their typical healthcare insurance. I do have quite a few patients when I was in the Air Force that that have followed me through my entire practice, and a lot of them have stayed in the Signature program. I have a lot of patients that have left the VA and actually, they're on Medicare and they love to be in the Signature program because, again, they have the time and the ability to see us. In the Signature program, we're quite different. And a typical practice of family practice internal medicine used to have around 4,000 to 5,000 patients. Mm-hmm. And so, if you're seeing a patient every 20 minutes, by lunch, I was 2 to 3 hours behind.
Wow.
At the end of the day, I was 2 to 3 hours behind. I usually didn't get lunch. I didn't get dinner. I'd be called to the hospital. You'd have phone calls and all these things disrupting the time you did have with your patients. And that's doing the best I can to take care of people. In the Signature program, you limit yourself to around 300 patients. And so you don't have that constant load. You don't, in a 45-minute, patient load, you see 5 patients in the morning and maybe 5 or 6 in the afternoon. So you always have room for people should they need to be seen, which is actually a wonderful thing. A lot of men wait until something falls off to ask for care.
Absolutely.
Especially if if you can't make the appointment, if you can't get through the office, if no one answers the phone, you get a computer, and then they don't know the doctor, they don't know the providers, they don't know the staff, people don't come in. And that costs a lot of people their lives. In the Signature program, when you first come in, all patients, if they're Signature or not, have a 45-minute appointment with me. And usually, I try to see what problems they have and try to fix them as much as possible. And I usually see all the patients again for another 45-minute visit. And then at that time, they decide either if they're going to stay and do the Signature program, or then on top of that, we have an hour and a half visit for a full intake. Or if they want to see me in my PA.
Uh-huh. So basically, the benefits of joining Signature for yourself and any other practitioners would be not only the financial benefits, but also that work-life balance. You're not being pulled in 1,000 different directions simply by your practice and having no energy to be pulled in any direction at all in your personal life.
Oh, it's true. I mean, it actually lets you do what I wanted to do all my life. From the time I was 40 years old, I knew I wanted to be a doctor. I wanted to be able to take care of anyone, anywhere, for anything that was wrong with them to the best of my ability and save their lives, and I do that every day. And it's wonderful because I don't have to sit there at the end of the day and say, what did I not do? What could I possibly have missed? I'm proud when people look at my notes, when they see how thorough they are. I don't have any trouble getting any of my patients in with any specialist because they know when those patients are sent over that they're sent over for the right diagnosis, and they're sent over with my records, which includes, again, 3 to 5 hours with a face-to-face time with me, so that the records are complete and they know exactly what's done, and so that they can just practice their practice of medicine, even if they are constrained to that 3 to 5 minutes that the typical doctor has.
Now, Dr. Ditz, as we wrap up this segment, concierge medicine, it still makes up a pretty small part of overall physician practices. In your opinion, why do you think that with better care, more time, that it's still such a small part of the overall healthcare picture?
Well, I think that a lot of people in the United States, and if I don't want to ever say anything that's improper, but they have this entitlement philosophy that doctors are going to be 100% perfect 100% of the time, and that insurance will cover everything. And so people watch TV and they think that a doctor can always make 100% of the right decisions with minimal diagnostic input at no cost, and that's not reality. That's not United States medicine at this point in time that we're being forced into with insurance constraints and again, I think we talked in our last conversation. There are a lot of my friends here in Melbourne, Florida, which also, if I talk to other people throughout the country, they're economically being credentialed by their insurance plans to see how much money they pay for their patients, how much money they spend on their patients. They get economically credentialed by their own employers. A lot of my friends that are actually on timers, they have beepers or timers attached to their belts, and if they go beyond 7 minutes, they're being reprimanded and fired because they spent too much time with the patients, because in that case, they can't make their overhead. And the facility can't go bankrupt by taking care of patients when they can't pay their overhead. And so, again, doctors are going bankrupt. The groups are going more and more impersonal because in my solo private practice, I have a person actually answer the phone. That was important to me from my time in the Air Force. If you're sick, the phone should be answered by a human being because it shows that we care, and I need to know what's going on when that person is sick enough to call the office. But then, beyond that, we have 6 other employees, and we have to have coders and billers, and of course, we have to pay our overhead.
Once again, if you follow the money, you find the problem in the system. You can't make, like you said, you can't make your overtime if you're spending, valuable time giving valuable information or at least comfort to a patient who desperately needs it.
Exactly. And then the thing about the traditional practice of medicine is that the doctor can only be paid for face-to-face time. Unlike an attorney that makes the laws, the doctor cannot actually be charging for anything except what they have directly with patients. So a lot of patients would like to stay at work and make a phone call and ask us some questions. And a lot of patients would like to have us, review their labs with them online, and things like that. When the doctors, they can't make their overhead by seeing the patients in front of them, they don't have the access to the ability to make phone calls and do, telemedicine and do emails and things like that, which, again, the Signature program does allow us the time to do that.
It's been great talking to you today, Dr. Ditz. You've been listening to Health Professional Radio. I'm your host, Neal Howard, and Dr. Ditz has been here talking about concierge medicine, specifically Signature MD Concierge Medicine, one of the oldest and major players in the concierge medicine arena here in the United States. And hopefully we'll talk again soon.
Thank you very much.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.